So let's say some of our viewers might be experiencing these symptoms right now, or they might be undergoing recovery right now. What do you like? How can they decide if they should continue running? They should stop running. What do they need to do?
Exactly. So very good question. And if you wouldn't have asked it, I would have told you to ask me. See, what happens when any person, I don't want to call him a patient, because when you call a runner a patient, they don't like it. So any runner, let us say, a runner comes to me and asks me, Doc, I've been running and now, my marathon is coming. I'm on 14 December. I have to run the marathon. So what can I do now? Should I continue or not continue? So to answer to that is to come to a diagnosis. So for a diagnosis, I would say I need a proper clinical evaluation. I need an X-ray and I need an MRI. So these are the three things. And in that particular order, you cannot directly send the patient to an MRI. First, clinically see him. Where is the pain? Medial side, inner side, lateral side, which is the outer side on the joint line, or at the patellar tendon, or proximally, or wherever. So then you can actually pick up the diagnosis clinically. Then you take an X-ray, and you can see on the X-ray sometimes, there is a little bit of stress fracture, and that can be another cause of the pain. And the third thing is you do an MRI. And MRI, if you get a 3 Tesla MRI done nowadays, it's quite sensitive. It picks up the injuries to 92% sensitivity and 96% specificity. So that's how accurate an MRI can be. And then you see in the MRI, whether it is a patellar tendon inflammation, whether it is a chondromalacia, that is the runner's knee, or is the meniscite tone, or is the IT band syndrome. So that can be differentiated. And if whatever the condition is, let's say now, if it is a meniscus tear, then of course that particular runner should understand that it's going to take time to heal. It's not going to heal in the next couple of weeks, or for that matter, couple of months. It may require arthroscopy. And then he should forego that particular forthcoming marathon and then train for the next season. It's not that he's completely out of it. The second is this patellar tendinitis, what we call as a jumper's knee. That if you give rest, icing, anti-inflammatory for a couple of weeks, then it gets all right. And then if the marathon is a few weeks away, he can still complete the marathon. Same is the thing with jumper's knee. Same is the thing with runner's knee. So runner's knee also, with rest, with NSAIDs, with proper icing and doing a lot of this taping, it definitely helps. And then the runner can continue the season and finish the marathon. But if there are some stress fractures, if it is a very serious kind of a IT band snapping syndrome and it is not going away with rest within 10-15 days, then it is better that the runner misses that particular marathon, misses that season, and then comes back in the next season fully cured, fully prepared, and he can, I'm sure, very successfully complete the next marathon.